Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Premier Dental Arts in Frederick, Maryland, discussing how you can improve your overall health and well-being through dentistry with two of this area's top dentists, Dr. Michelle Ware and Dr. Carl Appleton. Dr. Ware and Dr. Appleton both earned their dental degrees from Loma Linda University in California. They are both also members of the American Dental Association and the Academy of General Dentistry. Dr. Ware is also a member of the American Academy of Cosmetic Dentistry. Welcome, Dr. Ware and Dr. Appleton.
Thank you.
Thank you.
It's our pleasure to have you both with us. We've got a lot to talk about today. We've got patients coming up a bit later, procedure footage that we're going to see as well. So let me just begin, if I may, by starting with you, Dr. Ware, and asking you if you could please tell us about the various dental problems that you see from patients that come to your practice and that are quite common out there.
Sure. Usually what we see on a routine basis are patients that come in that have cavities, tooth decay. Periodontal disease is another common thing that we see every day. Older fillings that are starting to break down, recurrent decay around those older fillings, cracks in the fillings, cracks in the teeth. Those are a lot of the common things we see.
And I wanted to ask you, Dr. Appleton, is there a particular age that you see these dental problems that Dr. Ware just described being more prevalent during, or does it kind of vary all over the place depending more on each individual?
It can vary. One of the most common age groups we see tooth decay in is young adulthood, usually between 15 and 25, and then a little later in life during middle age, usually between 40 and 60, we're talking about getting cavities. As far as gum disease, again, the most common time then is between 40 and 60 in middle age, but really anybody can have these disease and have problems with their teeth. There isn't any specific age group that is excluded.
I got you. So basically, Dr. Appleton, as a natural follow-up to touch on what you just said, it pretty much is wide open as far as no age restrictions or more of a age range, I should say. It just depends on how people care for their mouth and their teeth through the course of life, and that results in the problems they have that bring them, obviously, to dentists like yourself.
Absolutely, yeah.
Mm-hmm.
And I wanted to ask you, Dr. Ware, how can these dental problems that you've described affect the overall health of a person?
Mm-hmm. That's a great question because there are a lot of recent studies that have come out that have linked issues and problems that people have in their mouth, such as periodontal disease or gum disease, and other how that affects the rest of their body. In other words, there are studies that show a link between gum disease and cardiovascular disease, respiratory disease, diabetes, and even low birth weight and early birth in children, babies whose mothers have had periodontal disease.
My goodness, so you're talking about some significant health problems.
Definitely.
That we're talking about, and the risks that are associated with these.
Yes, absolutely.
Dr. Appleton, I wanted to follow up with what Dr. Ware just said by asking you if you can please tell us how these dental problems can be detected.
The best way to detect dental problems is with a comprehensive exam. What we do is we have you come to the office and we do a visual exam where we look at the gums, the tissues of the mouth, and the teeth, as well as taking dental x-rays and photographs. All of those are tools to allow us to look and see what's going on and to best tell you what your overall level of oral health is.
Now, are there any common symptoms, Dr. Appleton, that we should be watchful for?
Some of the big symptoms to look for are sensitivities. So sensitivity to cold, sensitivity to sweets, sensitivity to heat. In some cases you may have pain on a tooth or swelling in a specific area. One of the big things about needing to have an exam done is that nearly 90 to 95% of problems with teeth may not have a symptom associated with them. So we use some new technologies such as the diagnodent, which would allow us to detect problems sooner so we can treat them in a less invasive manner.
Very well said. I think that's very important indeed. We're now going to watch Dr. Ware do a procedure.
All right, so we're going to do a comprehensive exam. First thing I want to do is check the joints here. Sherry, go ahead and open real wide and close again. And open really wide again and close. Any popping or clicking noises there?
No.
Any pain when you're opening or closing?
No.
Okay. And then go ahead and open. And we want to make sure that all the tissue is healthy, not just the teeth, but all the gums and soft tissue. Lift your tongue up towards the roof of your mouth. Good. You can relax it now. Soft tissue within normal limits. And bite closed. And open again. And bite closed. Good. And occlusion within normal limits. Nice crown there. Okay, so I won't go through each and everything. So now, Sherry, you're interested in straightening out your teeth?
Yes.
Okay, their options are, I think you'd be a great candidate for Invisalign. It would probably be less than a year because you don't have a whole lot of teeth aren't all that crooked, but I think an Invisalign would be a great orthodontic treatment for you.
We're now going to meet some patients from Premier Dental Arts. Welcome, SHEILA.
Thank you. It's really good to be here.
Oh, it's our pleasure to have you with us today. We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I want to begin by asking you, SHEILA, what dental problem or problems were you experiencing prior to coming to Dr. Ware?
I basically just had a mouthful of old fillings, you know, the old silver type things, and it was just time to replace a lot of those and a good thorough checkup and update.
So you basically just said, I'm at that point in my life where I've neglected things for quite some time and I want to get it all cleaned up and checked out like you said.
Correct, yeah.
So then what happened when you came here to Premier Dental Arts?
I got a good thorough workup, x-rays, etc., and basically recommended to replace all the old fillings, which they replaced with this great, you know, new naturally matching coloring for the teeth, and also got upper and lower veneers also for cosmetic purposes at that time.
Oh, and I take it you're very pleased with the results?
Very pleased, yes.
And for those viewers out there that are watching that live in the Frederick region here in Maryland, and they're basically in your position, or what you were prior to coming to Premier Dental Arts, what would you say to them?
Oh, if you can do it, please do it. It really makes a difference in your overall confidence and just your general outlook.
Well, on that note, I'd certainly like to thank you, SHEILA, for joining us and being a guest on our program.
Thank you.
Welcome, Robert.
Great, thank you.
Oh,
Thanks for having me.
It's our pleasure to have you on today as well. I wanted to begin by asking you what I just asked SHEILA a few minutes ago, and that is, what dental problem or problems were you also experiencing that made you come here to Premier Dental Arts and Dr. Ware?
Sure. I had some pretty severe crowding of my teeth, both the top and bottom.
Okay, so basically you had a crowding issue.
Sure. Mm-hmm.
And so then you came here, and what took place?
Well, sat down with the friendly staff, and they just kind of walked me through some of the steps that we can take to correct the problem.
And what was involved with that, just like in a basic sense, so we have an idea?
Sure. Well, we came in, set up the first appointment, sat down, they took all the examinations, the x-rays, and, just kind of laid out, step by step, these are some of the things that we should do and ought to do, and then it was just a matter of setting it up from there.
Now, did this take place as far as removing the crowdedness in your mouth with the crowded teeth over a couple of visits, or how did it play out?
No, we pretty much laid out a plan after the first visit.
Okay.
Mm-hmm.
Okay, and then from that point forward, you had that problem taken care of?
Yes. Yeah.
You don't have crowding in your mouth anymore?
No more crowding.
Good. I take it you're very pleased with the results.
Very pleased.
And for the viewers out there watching, just like I asked SHEILA a few moments ago, what would you say to those folks regarding Premier Dental Arts?
I think it's the best. It really is. So we came in, like I said, laid out a plan. They suggested Invisalign, and which I had never heard of, but it was the best thing for me. I speak in public as a profession, and so I didn't really want to have braces, showing, and Invisalign was the perfect thing. And just a few months later, straight teeth.
And like you just said, being out there, a busy professional in the public, quite a bit based on your job, that's the perfect way to straighten your teeth with invisible braces, which is what Invisalign is.
Exactly.
So I'm very happy to hear that. And on that note, I'd like to thank you as well, Robert, for joining us and being a guest on our program.
Great. Thank you for having me.
Our pleasure. Welcome, Chad.
Hi, thank you. It's nice to be here.
Oh, it's nice to have you with us as well today. I want to begin by asking you, what dental problems were you experiencing as well that made you come here to Premier Dental Arts and Dr. Ware?
Before I came here, I had spaces in between the front teeth, and I was always self-conscious of my smile. So I came in, and they suggested I have some veneers put on, which they did, and I loved it.
And so basically you had spacing issues like you just touched on, and then you came here, I take it they did some exams, x-rays, things along those lines initially, and then they came to the conclusion that the best recommendation in your particular case with your problem would be veneers.
Yes.
And then how long did that process involve? Was it all done in like a trip or two? Or
it was all done in 2 trips.
Oh.
Yeah, about an hour each time. It was nothing.
That's nothing.
Yeah, it was nothing.
That's great.
Yeah.
And so have you had to go back for any follow-ups or anything? Or
No, just regular checkups.
That's it.
That's
And
it.
you got that smile back and that confidence, right?
I did. I wanted them right back. I wanted back before my wedding for pictures, and it turned out perfect.
Oh, I'm very happy to hear that. And for the folks out there watching, I wanted to ask you as well, Chad, what would you tell them about Dr. Ware and her fine staff and the other dentists and Premier Dental Arts over here in Frederick, Maryland?
It's a fantastic place. It was painless, and it was done really well and in a very, very short amount of time.
Well, on that note, I'd like to thank you for joining us as well and being a guest.
Thank you.
Our pleasure. We're now back with both Dr. Ware and Dr. Appleton. Patients were very happy with the results, doctors, and I think it pretty much speaks for itself, how they feel today as opposed to what they were feeling prior to coming to your practice. What treatment options, Dr. Ware, are available to address these dental problems that both you and Dr. Appleton have described thus far today?
There are many treatment options available, but the main goal is to first determine the problem and then determine how we can get rid of the source of that problem, whether it's gum disease or whether it's tooth decay or cracks in the teeth. The goal is to have healthy mouth, healthy gums, healthy strong teeth, fresh breath.
Yes, indeed. That's what we all strive for. That's right. So there's no doubt from what you just said, Dr. Ware, that there's a very strong connection between our dental health and our overall health as well.
Absolutely.
I understand, Dr. Ware, that your practice has a unique approach when addressing dental problems, and I wanted to see if you could elaborate and tell us about that, please.
Well, we really believe in getting to know our patients on a real personal level, and we want to be able to provide the best care for them, but first we need to see what their needs are. I think one thing that's unique about our practice is the way we educate our patients. What is a healthy mouth? Many people don't even know that. We use the healthy mouth baseline in order to educate our patients so they can see what a healthy mouth really looks like.
Now, I wanted to ask you, Dr. Appleton, what are some preventive measures that can be taken to minimize the risk that you've described here today?
One of the best things to do to prevent dental problems is really to see a dentist. Come in for regular exams at least twice a year and have cleanings done. At home, best things you can do is brush your teeth and floss at least 2 to 3 times a day.
Okay, and try to, I take it, eat a little bit less sugar?
Diet is a great thing to do as well. Having a low sugar diet and a healthy diet overall will make a big impact on your overall health and your oral health.
Yes, indeed. Well said. Now, we've only got a few moments left, Dr. Ware and Dr. Appleton, and I wanted to ask you, Dr. Ware, if you have any final thoughts that you'd like to share with our viewers, because certainly you and your practice here, Premier Dental Arts in Frederick, Maryland, have developed a reputation for excellence in the field of dentistry, and we're certainly very honored to have you both with us today as our dental experts. And I wanted to ask you if you can put some final thoughts to that.
Well, you know, we have really a great team here, a team of professionals who get to know our patients on a personal level. And that personal care, I think patients really do appreciate. We also have state-of-the-art technology, and we want to provide patients with the best high-quality care that's going to last. But I think most importantly is being able to give patients a beautiful, healthy smile. I think one of my favorite things is when a patient comes in and they don't smile because they're ashamed of the way their teeth look. And when we get their mouth into a good, healthy state and we can give them a beautiful smile, whether it's through Invisalign, which is an orthodontic type of treatment, or veneers, sometimes a combination of both. But when that patient walks out of the office with a big smile on their face because now they feel confident, that's a big part of their emotional health, which is another thing, a benefit that we really enjoy seeing patients, that transformation.
And we certainly saw that, in fact, with both Chad and Robert, 2 of the 3 patients we had on, who actually did benefit from
Right.
Invisalign and veneers, and literally became a new person as far as the confidence and the happiness that they gained from that.
Right. That's one of our favorite things, I think, to see. It's really rewarding for us.
Yes, indeed. And on that note, I'd like to thank you, both Dr. Ware and Dr. Appleton, for joining us and being a guest on our program. And certainly our research has borne out what you've said here today as far as your patients loving you all and how you all look at them as family and really go that extra mile to make sure they're taken care of, and very pleased with the results indeed.
Thank you.
Thank you both. Love to have you both on again in the future.
Sounds good.
Absolutely.